Thank you for the opportunity to present to you today. It's a real privilege to present alongside Paige Sable from Boston Children's. My name is Tavo Zavala, and I lead what's called the School Transition and Reentry Service here at Children's Hospital Los Angeles in the Cancer and Blood Disease Center. And as the slide suggests, I'm going to be presenting on giving kind of a general overview on working with schools when a child has chronic illnesses. And then Paige, with her expertise, will focus on specifically on school-based issues and accommodations for children with bladder exstrophy. And some important disclaimers before I begin. This is intended to be a general presentation for informational purposes, and it's not intended to be legal advice, and so the legal accuracy is not 100% guaranteed. And it's not intended to replace any advice given to you by your child's medical team, including his or her physician, nurse practitioner, psychologist, and social worker. And state and federal laws, they change often. And so it's important for you to stay on top of that and to check out the websites regularly. Okay? Now, a lot of times when I attend presentations about, working with schools and with chronic illnesses, or I give presentations, I find that there's an assumption that everybody knows school the same way, thinks about school in the exact same way. And even though it's such a basic thing, the reality is that's not always true. And so I'd like to start by having us try to get on the same page about what school even is. And I want to start by talking about why school is even important. It's not just about the reading, writing, and arithmetic. School is equally as important, both socially and under the law, for the social and emotional development of the student. It's also your child's civil right to attend school, and it's also the law. Your child must attend school at least until they're 16. Oops, wrong one. Sorry. It might also help for us to review our knowledge about the most common or basic kinds of schools out there. This will help us when we talk about working with schools. It's good to talk about, just get on the same page about the different kinds of schools that are out there. And so this chart is just kind of a summary of some of the most common types of schools that we know about. The first is obviously the most common type of school, and this is a public school, and this includes the so-called magnet schools. These are schools that are publicly funded. They're run by a school district or other state agency. They're normally assigned by residency or special education placement, and these schools must adhere to all state and federal special education laws. Now the next kind of school up there, the charter school, is often a misunderstood type of school. These schools are also publicly funded, and a lot of people think they're like a private school, but they're not. They're publicly funded. They are independently run, so they maintain a contract with a public school board, and they are exempt from some state laws. For example, here in California, charter schools don't have to use union teachers, and they can set up their own academic calendar. They are what's considered a school of choice, so you have to apply to go to the school, you have to get in line. But these schools, just like any other public school, must adhere to federal and state special education laws. And I emphasize that because a lot of people think that that's not the case, and in fact it is the case. Now there's another type of school. It's really more of a program called independent study. Some of these are publicly funded. Some are provided through the school district, but school districts are not required to have these kinds of programs. These are schools of choice, and in fact they are often an alternative to the traditional classroom setting. So they're often done mostly online. Sometimes the student does go on campus a couple times a week or a couple times a month, but it's mostly done at home and online. And these schools have to adhere to state and federal special education laws if they are run by a public school district or they're somehow part of a child's special education placement. And then the last kind of school that we're quite familiar with is a private school. And as the name suggests, these are not publicly funded. These are completely independently run, and they are also a school of choice. And because they don't receive public funding, they're not required to follow state or federal special education laws. And so most of what I will be discussing applies to schools that receive some form of public funding. So as you may know, as most of you have in your experience, you will know that chronic illness can really impact a child's ability to learn, to go to school, to access education and learn. And so I want to talk about some federal and school-based tools that are tools and plans that are available to you when working with schools to address the needs of a child who's impacted by chronic illness. These are the Individualized Healthcare Plan, the Americans with Disabilities Act, Section 504 of the Rehabilitation Act of 1973, and the Individuals with Disabilities Education Act, known as IDEA. Let's go over some of these in detail. So the Individualized Healthcare Plan is recommended if the healthcare of the student affects safe and optimal school attendance and academic performance. And by the way, if you see text in parentheses, or rather in quotes or in italics, that's usually text that I've copied and pasted directly from the state or federal law or from official policy. And these plans are developed by the school nurse along with in collaboration with the doctors and the parents. And they can allow a student to safely attend school while other formal accommodations are being established. And common things are included are things like a summary of the illness and diagnosis, medications that need to be taken at school, and procedures like dressing changes, tube flushes, and things like that. I will be discussing later on what are called 504 plans and IEPs, and these things can be incorporated into those things. In and of themselves, an individualized healthcare plan is not recognized in federal law, so it doesn't have some of the protections and procedural safeguards that some of these other more formal plans do. So let's jump right into the laws themselves. And these laws are not listed chronologically. They're listed more in terms of relevance specific to the school setting. And the first set of laws I want to just review with you are anti-discrimination laws. And everybody's quite familiar maybe to some extent with the ADA, the Americans with Disability Act. It was signed in 1990. And Title II of this act specifically reads, no qualified individual with a disability shall, by reason of such disability, be excluded from participation in or be denied the benefits of services, programs, or activities of a public entity. And a public entity in this case includes any school that receives public funds. So that's all public schools and even some private schools. And generally speaking, it bans discrimination in public spaces, and that can include parks and camps, restaurants, and it mandates that people with disabilities have reasonable accommodations in these settings. The next law rather is Section 504 of the Rehabilitation Act of 1973, and this is actually the first federal civil rights statute for persons with disabilities. It protects qualified individuals from discrimination based on their disability. It applies to any entity that receives public funds. And protections under this law include what I'm going to talk about in a bit, the 504 plan. So just to kind of talk about the difference between the two, Section 504 provides for specific protections in places that receive public funds, such as schools. The ADA provides for more broad protections in public places, even if they don't receive public funds. And then the next really important law is the Individuals with Disabilities Education Act, known as IDEA. And this was signed in 1975. Back then it was known as the Education for All Handicapped Children Act. It's a funding statute, and it states that basically it gives states educational agencies federal funds to make special education available to any eligible student. It requires school districts to identify and evaluate any student who may need special education, and requires school districts to provide appropriate special education to students who need it. So I want to go back to talk about some of these plans that I alluded to earlier. And let's talk first about the 504 plan. Who qualifies for a 504 plan? Well, any student who has a physical or mental impairment that substantially limits one or more major life events. And there's a list of major life events, and learning is one of those. It's a documentation of the student's needs and what accommodations they're going to get. And the idea is that it tries to ensure that the student has the same access to educational school environment as a student without a disability. And common types of accommodations, examples of accommodations you would put in a 504 plan would be like excused medically based absences, allowances for bathroom breaks, allowances to carry water, things like that. Paige is going to go into a lot more detail about the kinds of accommodations children with bladder exstrophy can have in a 504 plan. And these can also include the accommodations in the individualized healthcare plan that we talked about earlier. Now, a 504 plan typically does not provide for modifications in curriculum. It usually does not provide for very specialized services. So kids can get physical therapy, occupational therapy in school, but not usually through a 504 plan. It's actually not required that the plan be written out by law, but most school districts do it because it's best practice. And children have to be evaluated for their needs to get a 504 plan. Now, parents don't have to be notified that this evaluation is going to take place, but they don't have to actually consent to it. The schools can do it without the consent. But parents do need to be notified before any major changes to the 504 plan. Now, the Individuals with Disabilities Education Act that I mentioned earlier, this is what provides for special education. So when a child is getting special ed, they're getting it under this federal act. Now, what is special education? It's important for us to really talk about it because there's a lot of myths and stigma around that. Special education is specially designed instruction at no cost to the parent to meet the unique needs of a child with disabilities. This does often include a modified curriculum. It can also include related services. So this is where you can get things like physical therapy, occupational therapy. And the law states, and I'll go back to this, that a child has to be kept in the general education setting as much as possible and only removed to the degree necessary. Well, who qualifies for special education? Anyone between the ages of 0 to 22 years of age. There are 13 specific disabilities that qualify someone for special education, and one of them is something known as other health impairment. And it covers students who have limited strength or vitality caused by a chronic or acute health problem that's not temporary in nature. So there are many conditions and diseases that qualify under OHI. This condition has to adversely affect their educational performance. And this condition has to create the need for special ed. Other examples of diseases and disease categories would be things like autism, blindness, and language impairment, to name a few. How is the need for special ed determined? There's a portion in the idea in the act that says, called Child Find, and it says that states must identify and evaluate students who are suspected of needing special education. And then they have to conduct a formal assessment to determine whether a child qualifies, and if so, what their needs are. Anybody can request this assessment, but in this case, parents must consent to the assessment. And the assessment child must be assessed in all areas related to suspected disability. An assessment can consist of very standardized test batteries, classroom observations, and interviews with parents as examples. And the team may include the school psychologist, specialists like a physical therapist, occupational therapist, and then school districts have to take into consideration input from outside experts. So for example, a neuropsychological assessment that was done at a hospital needs to be taken into account by the special ed team, or maybe notes from a physical therapist outside of the hospital. So if these evaluations determine that a child needs special education, the student receives what's called an individualized education program, and I should have spelled that out on the slide, but that's more commonly known as an IEP. That's what a child gets if he or she qualifies for special ed. The IEP documents the special education program, so it lays it all out. It is a legal contract between the school district and the parents, and at the very least it's got to include things like a summary of the findings. What did the assessments find? Where is the child performing academically at this point? What are the goals they have to address the needs? So if there is a need for special education in mathematics, they set a goal where the child will complete a certain amount of calculations with 80% accuracy by the end of the year, things like that. Placement, where is this all going to take place? And we'll get to that more in a bit, but is it all going to be in the general ed classroom or somewhere else? And a list of any specialized services. So does the child need occupational therapy at school? That's laid out in the IEP. Now, the services for children 5 years or younger, just as an aside, those are known as early childhood intervention services. And for children of those ages, they get what's called an individualized family service plan, an IFSP, and that's basically the equivalent of an IEP for children of that age. So more on the IEP. When a child has an IEP, it has to be reviewed by the IEP team and the parents in a meeting every year, and the child has to be reevaluated every 3 years. Now, parents have many, many rights with respect to special ed and the IEP, things like have rights with respect to signing it, requesting meetings, and filing disputes with the school. The law also requires that by the time a child turns 16, the IEP team must help develop a plan for transition for them. What is good life after high school going to be like, and what resources do they need to achieve those goals? There's a lot of strict timelines by law for an IEP, and an IEP compared to a 504 plan really provides for a lot more comprehensive services, a lot more procedural safeguards and protections. Now, an IEP must meet the unique needs of a student. This is really important. That means that no two IEPs should look alike. An IEP must provide education that's appropriate and meaningful in light of the student's unique needs, and special education must be provided in the least restrictive environment. So I want to get back to that again because we mentioned that. What is the least restrictive environment? Well, the law states that students with disabilities must, to the maximum extent possible, receive education with their non-disabled peers. And this graph is to show you the common levels of restriction in the public school system, with the top part being the least restrictive environment. That's when a child is basically 100% of the time in the general education class, to the most restrictive in the bottom. So when a child is in the least restrictive environment, they're in the general education class all the time. Sometimes this is referred to as full inclusion or mainstreaming. Those aren't legal terms, but school staff use them all the time. And then they get some supports within the classroom as needed. And then the next double down is most commonly known as a resource specialist program, and that's when a child has to be pulled from the general education classroom less than 50% of the time. So they go somewhere else to receive specialized instruction in one or two subjects or some other assistance in other subjects. And then the next level down, when the need is kind of more deep, when the disability maybe is more severe, there's the special day class, and that's when a child is pulled out of general education more than 50% of the school day to receive the special education instruction. And then the last three categories are the most restrictive environment. These are for students with very severe needs. There's what's called a non-public school, where a child's enrolled full-time in a specialized school. And then you've got schools that are like that, but the child actually lives on campus. That's a resident school. And finally, there's home instruction. Now, this is really important to distinguish. This is not the independent study that I referred to at the beginning of my presentation. This is referring to something called like home hospital instruction, where a child is not medically cleared to go back to school, and so they have to receive their instruction at home, and it's usually very limited amount of instruction, and so that's considered under the law the most restrictive environment. What's the point of all of this? The point of all this is a concept known as FAPE. FAPE stands for Free Appropriate Public Education, and it is the overall requirement of an IEP or a 504 plan. The legal definition is as follows. FAPE is special education and related services that A, have been provided at public expense, under public supervision, and without charge. So there's your free and your public. It must meet the standards of the state educational agency, so there's your education. And it must include appropriate, and that's really important, appropriate preschool, elementary school, or secondary school education in the state involved, and for those who have an IEP, are provided in conformity with the individualized education program. So when a school district fails to provide appropriate special ed services, appropriate accommodations under 504 or appropriate special ed, they are failing to provide FAPE. And this is important because if your child has an IEP or 504 plan, or if you ever intend to seek one, this is a concept that you should know well and reference often when advocating for their needs. These are some tips and guidelines that I've gotten over the years of doing this. They're not law. They're kind of what I've learned, in the trenches, and also tips that I've been given by other special ed advocates. Number one, always submit your requests and ask for replies in writing. You want to have a paper trail all the time. If you don't, and you ever have to, kind of butt heads with the school, if it's not in writing, the school always wins, basically. If submitting typed or handwritten notes, and you can request things in a handwritten note, Always request a date stamp copy for your records. Email is good because the date stamp's already there. And the reason this is important is, number one, the date stamp is proof that the school district even got your paperwork. And also remember, for some things there are strict timelines in which the school district has to do things. And how are you going to prove they're in compliance with that? It's that date stamp that's on there. Document everything. I think I talked about why that's important. You also want just a history of what's going on. Now, this is an interesting one. Address your request to the assistant principal, if you have, your school has one, and copy other relevant school staff. What I have found, over the years of doing this is that usually it's the assistant principal who's directly responsible for special education services and 504 plans. And so you want to at least submit your initial request to that individual, and they would know how to write it. Make sure you work with your child's entire medical team, so that the doctors, the social workers, the nurse practitioners, psychologists, and if your hospital has one, a school advocate. Do your homework, research your rights, and consult with trusted advocates or attorneys as needed. And as I mentioned before, keep your focus on FAPE and reference it often. If you're in there in the meeting room with the school staff and you really need to fight for your needs, remember FAPE. It all comes down to FAPE. Hand it off to Paige.
So now that we're all a little bit more familiar with some of the laws regarding school and the general plans that can be put in place, I'm going to talk a little bit about considerations for children that have bladder exstrophy. So if we're looking at a 504 plan or an IEP or some other plan putting in place in the school, what are some accommodations that we typically see? So before I get started, I'm going to talk a little bit about my role. I'm a social worker at Boston Children's Hospital, and I work in the urology department there. So I work not only with children and their families that have bladder exstrophy, but then also a wide variety of urological diagnoses. And myself and my colleague help with anything from community resources, access to care, coping, mental health, but then also we spend a good deal of time specifically working on these school issues and working with families and teaming with them to make sure that the kids that we're working with are getting appropriate accommodations in the schools that they're in. So I just want to remind everybody before I start and before I give you guys a list of accommodations that we see that every child is different, every family is different, and every school is different. So these accommodations might look different. They might be accomplishing the same goal but be different in different settings, and they're going to differ based on your individual child's needs. Also remember talking to your care team about any specific challenges that you guys are having at school. Bring it up in your clinic visits. Your doctors want to know that, your nurses want to know that, and they might be able to help. They've probably talked to patients before that are having similar concerns, and oftentimes somebody in the clinic can even reach out to the school or help you guys in that way. I know we regularly will write letters to the school explaining what's going on and why we're recommending certain things from a medical team and from the doctor. So that's something to keep in mind. So when we're looking at accommodations, you want to consider that there's a spectrum of needs that you want to be looking at. So certainly the first thing that comes to mind is the medical and nursing accommodations. So that could be anything that's going to be something that's recommended in clinic. So catheterization, going to the bathroom a certain number of hours, changing pull-ups, drinking water, things like that that are coming from your team. But then thinking about what the implications of that are on the academic and the social needs of your child as well. So are they missing class time when they're going down to the nurse's office to potentially change? Thinking about those things and thinking about how we can address those. I recommend a team approach between the school, the parents, and the care providers, making sure that everybody's really on the same page and understanding what is happening at school, and having an open dialogue and conversation can be really helpful. And also keeping in mind that not all accommodations are going to apply to every child, and each child might have different needs depending where they are in their medical journey at that time. So I bring this up because a lot of kids that we see, sometimes they don't need any accommodations or very few accommodations one year, but then the next year they might have a planned surgery for a very complex surgical need that they're going to be in the hospital for a couple weeks. So thinking about that and what that's going to look like when they're missing school, when they're coming for all these extra appointments, and then when they're going to be inpatient, and do they have any restrictions afterwards? So thinking about that when those things come up. Academic accommodations that we do see for children with bladder exstrophy would include things like extended testing time, alternate testing days, breaks, establishing a plan when schoolwork's missed. So like I said, I know that we had talked about centers of excellence. I know a lot of you travel quite a distance to seek medical care. We have patients in Boston that have to miss multiple days of school when they come for yearly or more than yearly visits simply because they're traveling. So is there a plan for that? Adapting or waiving the PE curriculum. Like I said, sometimes when kids have surgery and they're recovering from that, are there things that they can do in gym but other things that they can't? Or maybe they will be able to in a few weeks or a month. Planning for prompt homebound services for extended periods of illness or inpatient hospital stays. I know we try really hard when we know that kids are going to be admitted to the hospital, getting them hooked up to tutors in the hospital whenever we can and whenever that's possible. Providing duplicate copies of textbooks, arranging for adult tutors at school or at home to help with that missed work. Providing any appropriate technology, adjusting attendance policies. We have a lot of kids where the attendance policy is, there might be a strict attendance policy generally, but they don't have to follow that because they're missing school for appointments and the school is aware of that. Adjusting schedule of staff assisting the child. So that would be if, for example, the school nurse is helping with catheterizations or helping with something else. Making sure that that nurse is in the building that your child is at 11 a.m. when they know that they're going to need to be catheterized. Adjusting the school day schedule, and again, providing rest periods. We sometimes see that as well. Collaboration and communication is really important, and this is also something that can be written into some of these plans. Thinking about how you as a parent would prefer to communicate with your school and the teacher regarding any concerns that you have about your child's medical needs. So some parents like to text their teacher or have phone calls with them or email, and really thinking about what your preference is and then talking with the school about what's feasible and what the plan's going to be. Establishing communication between health professionals, school nurse, and home. Again, that team approach. So oftentimes if you as a parent are comfortable with your clinic reaching out and talking with the school, we'll have a conversation in clinic about getting those releases signed just at the visit, because then those releases allow open communication if there's any issues that come up throughout the school year, that allows that open flow of communication so that the school can reach out to our nursing staff and troubleshoot any issues. Scheduling periodic homeschool meetings. So I know that academically you have parent-teacher meetings regularly with the school. So if you're having conversations or those meetings are pre-scheduled, thinking about maybe also during those times of year having a conversation with the school nurse and being able to kind of check in at the same time about how things are going at that time. And then maintaining logs documenting health and school concerns. I know sometimes we have kids that come in and it's being recommended that, oh, we want to see how often you're catheterizing, or we want to keep track of how much you're trying to drink every day. And making sure that the school's aware, if you as a parent are kind of trying to keep track of some of the stuff at home, so that they can also keep track of some of the stuff at school. Dietary accommodations. One of the most common ones that I do see that we regularly are talking to school with is unrestricted access to fluids. And like I said, the goal might be unrestricted access to fluids, but this can look out and play out differently, kind of depending on the child and the school and the preference. We have some kids that have their water bottles just at their desk. We have other kids where there's a water fountain in the classroom or right down the hall, and they're allowed and expected to just get up and drink whenever they need to. So it can look different depending on what your child prefers to do or what the school kind of can accommodate. And then we also sometimes see different dietary recommendations from the medical team, and being able to talk to school nutrition services about how to accommodate that. So if there's an increase in wanting your child to have more fiber in their diet or something kind of along those lines, sometimes we see that. Health and personal care accommodations. So these are the actual accommodations that are going to be coming kind of from the medical clinic that you guys are doing as medical care. So things like providing unrestricted access to the bathroom. If your child needs to have that unrestricted access to the bathroom, we want to make sure that they can actually just get up in the middle of class and go to the bathroom without any teacher kind of giving them a problem about it or telling them, no, you have to wait until I'm done with the lesson, making sure that they can go. Providing help and support when needed for cleaning and changing. And then also providing a private bathroom with storage for supplies if that's something that's needed. So I know some kids, they actually use the school nurse's bathroom, so they'll have like a change of clothes and catheters and pull-ups and whatever other supplies that they might need, they'll just keep it in the nurse's bathroom so that it's not in their backpack. They don't have to worry about someone finding them. It's just there for them to use whenever they need to. Again, providing trained personnel for procedures, so such as the school nurse if they need help with anything. And then arranging trained personnel for field trips as well. So thinking about there's this great plan in place for while they're at school, but then what's the plan if they get on a bus and go to the museum? And then of course making an emergency plan. So when are you as parents, you know your child best. So if you know that there are some symptoms where you would call your clinic or call the doctor, make sure that the school knows that too, because you know your kid. So I know that the next presentation is actually all about disclosure, so I'm not going to spend too much time on this. But just know that this is something that does come up when we're talking to kids about coming up with plans for schools, just because a lot of what we hear in clinic is, well, I really don't want my friends to know that I have to go down to the nurse's office. I really don't want them to find my catheters in my backpack. So thinking about how we can respect their privacy and thinking about how we can support them. We actually do a lot of role play in clinic. So we practice if kids are nervous about certain conversations or nervous about certain things coming up. I pretend to be their peer, and we sit and we talk about it, and we say, okay, where is your boundary? When are you going to say, I'm really not comfortable telling you that information? And how they're going to word that. Because usually if there's a boundary set, kids will kind of stop. So then establishing a new plan with each school year is very important as well. Usually at the beginning of each school year, there needs to be new orders for treatment or medications or things like that. And that's a really good opportunity to kind of sit down and assess and think about what went well last year, but what maybe could go a little bit better next year. So thinking about that and including those red flag checklists, of course, as well. So thoughts for consideration. We want to identify strengths and differences in each setting. So if your child is transitioning from, say, elementary school to middle school, what are some things that went really well in elementary school? What are going to be some differences with middle school? And how can we help this child transition to the new teacher, the new nurse, whatever's kind of changing the next year? Building a strong team, so making sure, again, that your clinic is aware of what's going on so that they can support you if you guys need it. And deciding who's on first. So who's going to take responsibility in the school setting to make sure that your child has the support that they need and can ask and feel comfortable to ask for help if something's not going well. Usually this is the school nurse, but sometimes it's not. Sometimes it's the classroom teacher, sometimes it's the principal, assistant principal, whoever. always recommend taking a positive and collaborative approach, but also proactive. So like I had mentioned, sometimes we know that kids in a couple months from now are going to be on the books for surgery, right? So if we know that, can we reach out to the school and try to develop a plan ahead of time? I always recommend involving your child's healthcare team, but then also involve your child. Your child is the one that's in school all day, and they're the ones that are really kind of living in the school setting and spending all these hours at school. So they're the ones that are really going to be important in kind of helping to develop the plan. So I'm going to very briefly talk a little bit kind of about typical development in different age groups, and we do know that there can be an impact when kids are coming to the hospital very frequently or being admitted. And thinking about when we're looking at these school accommodations, what can we do in putting these accommodations in place that are really specific to where the kids are at developmentally. So in like that daycare preschool age group, 3 to 4, we're seeing a lot of jumping, climbing, very active, shorter attention spans, fear of bodily injury, increasing independence, using a lot of play. Impact on development when kids are coming to see us a bit and having kind of some of that testing done that goes along with this diagnosis sometimes. We can see an increase in fear of strangers, for example, right? So if they're coming to the hospital and they're meeting a bunch of nurses and all of those nurses are poking and prodding them, it makes sense that they're going to be a little bit more nervous with strangers. Increased stress and acting out when routines aren't followed. Fear of loss of control. So what can we do in this age group? Keeping routines and schedules consistent, setting limits and offering appropriate choices, providing positive coping and soothing techniques like that deep breathing we all learned earlier. Remembering that you know your child best. They're still developing their language skills at this age, right? You always know your child best and you can always be an advocate through their entire childhood and beyond, but especially in this age group when it's harder for them to say, no, this isn't okay, being a really good advocate for them. And then offering appropriate choices. So what does this look like in this age group? If somebody's recommended to drink water, for example, during the school day, can they pick if they have a pink or a blue water bottle? Maybe, right? Elementary school. So in this age group, we're seeing kids begin to develop a sense of control over their environment. They're entering more formal school. The academics are kind of picking up the pace a little bit, and they're understanding kind of the relationship between things and ideas and still using play. Again, impact on development with kind of more frequent hospitalizations. We can see an increased stress and anxiety around painful procedures. We can see some regression like baby talk if they're in the hospital, anxiety about body alteration, fear of being sick, feeling left out. But what can we do when we're kind of looking at these school plans, right? So keeping routines and schedules consistent, considering home tutoring if they're in the hospital for a long time, so thinking about that earlier. And then setting limits, offering appropriate choices again. What can we give them a say in? What's appropriate and what are they allowed to choose? Promoting positive coping and soothing strategies, concrete explanations with simple descriptions for things, and then encouraging play again. So middle school, this is where we see kids kind of develop more of a sense of self-image, self-development, forming peer relationships and social comparisons. This is where kids really start to assert a lot of independence. So impact on development, this can be a challenging time for kids when they're having to rely on parents or caregivers, but they're wanting, like their peers, to be independent, right? So thinking about kind of that, in this age group, we see kids in kind of the late elementary, early middle school to kind of take a little bit more ownership of their health care, right? So having them in part of those conversations about accommodations at school, what the plan's going to be. Are they able to catheterize by themselves? Are they able to kind of change themselves if they're at school? giving them reasonable privacy and making sure that we're honoring that privacy with them. And then high school. So we're seeing kind of a focus on body image, just like kind of middle school, establishing and maintaining peer relationships. That feeling of being invincible can really come up kind of with this age group. Testing values, preparing for that kind of adult lifestyle. So impact on development with bladder exstrophy, we can certainly kind of see that decrease in adherence, like I know that we had kind of talked about a little bit in the last presentation, and kind of thinking about that in terms of with school. So when we're thinking about accommodations in high school, certainly we want to encourage and provide privacy when possible, but then also kind of think about what is going well and what do we kind of maybe need to keep an eye on. So I know sometimes we have kids that are coming to clinic and there really aren't any accommodations in school for high school, but could there be? Is there a way that the nurse could be supportive? Is there a way that the nurse could maybe help with some of these things and making sure that some of these things are being supported with the medical needs that need to be done at school? So being an advocate and a role model, a lot of the things that we are recommending in clinic are things that are just healthy lifestyle choices, right? So are you eating fruits and vegetables? Are you exercising? I know we talk a lot about things like that. So things, drinking enough water. So if they're seeing you as their role models and their parents doing some of these activities, it's going to be easier for them to do that as well. So in summary, you guys are not alone. Your medical team is there to help you. Your school is there to help you. Everybody wants to support your child and make sure that they can do the best that they can. If something doesn't seem to be working, speak up. Talk to your clinical team, talk to your school. They're there to troubleshoot and problem solve. And then, like I said, definitely consider your child's insights and allow them to offer additional input as they age. They're the ones that are in school, so it's really important to take what they're saying into consideration when we're coming up with these plans with the schools. So these are just some references. Okay, questions? Yes.
There's a question over there. Yeah.
Yep.
So this might be a legal question, so I don't know if you're going to be able to answer it, but regarding the law for students with special needs and let's see, it's not the 504 plan, but their civil rights, legal rights, I think it was, law for students with special needs. The state of California is changing their sex education plan, and it starts in junior high, I think, where they're becoming real explicit, showing pictures about body parts and what you do with those body parts with the opposite sex and that sort of thing. And they're saying that parents are not going to be able to opt out of having their children go to that. But my child would not identify with any of the pictures or anything, so it'd almost be discrimination against him, putting him in a position where he's starting to be self-conscious about himself, but now that's going to throw him up into a whole nother level of feeling self-conscious, and whether that's healthy or not. Do you have any idea if he would be covered under any of this?
So he wouldn't be covered necessarily under the Individual Disabilities Education Act unless he had special education and has an IEP. He's got a 504 plan. So if you could argue that somehow his civil rights are being violated, 504 plans are civil rights protections. And so if that aspect of the special ed class, and again, I'm playing lawyer here, so my final answer is going to be consult with a lawyer, with an attorney. But my understanding is that the idea under a 504 plan is that it's supposed to remove any barriers a child may have because of a specific medical condition, to access to education. So if somehow all of this is related to his medical condition and it presents a barrier to his learning or to his accessing the education, or on the other hand, if you can tie it into some sort of like hostile environment or bullying, then you may be able to file for file a claim or make a case under the 504 plan. Otherwise, if it's more of a matter of an issue with the standard academic program, you could maybe still call it a civil rights issue, but it wouldn't be necessarily under that component of the 504, of the Rehabilitation Act of 504. Okay, does that make sense? Yeah, okay.
So if it's the impetus for a negative reaction in him psychologically or whatever, then it might be covered under that, is what you're saying.
Well, specifically under 504, if the negative reaction cause is somehow related also to his medical condition or So if there was a reason, a medically based reason why he identifies or feels a certain way, and then that situation will cause that, you could theoretically then argue it under the section 504. Otherwise, there might be some other aspect of civil rights law that I'm not familiar with that you could maybe invoke in addressing that. I mean, either way, it's important because it affects his ability to access the education from an emotional level. And remember, school is not just about reading, writing, and math. It's about the social interactions, about the emotional development. If that's something being impacted, you definitely have the ability to address it legally. I just don't know if it fits naturally under this particular 504 plan protection. Does that make sense? Mm-hmm. Okay.